In that case, we looked at women's health clinic closures in Texas and Wisconsin, and we looked at the impact of that on preventive care, specifically split by ethnicity. So looking at non-Hispanic white women and looking at Hispanic women. And we found that preventive care for Hispanic women drops substantially when access to these kinds of clinics decreases. And many of the cuts and procedural changes that led to clinic closures that were happening in these states were done for other reasons. They weren't done to reduce preventive care. And so we're finding that these policies had unintended consequences that should be factored in as we consider other state and federal policies like them. Our sense is that women are not going to these clinics primarily for preventive care. They're going for other kinds of family planning and reproductive related care. And while they're there, the providers are saying, while you're here, you really should get the following preventive care screenings. And the marginal cost of them doing so is small, and so they do. If you remove those clinics, you can't just take those funds and reappropriate them in preventive care, because women aren't seeking out preventive care because preventive care has no current benefit and has a current cost in terms of time or money or both. And so a policy to mitigate this would probably be to increase the funding going into preventive care, more than the funding cut from women's health and family planning, to try to mitigate those effects.